So let's continue our conversation about the barriers that we can encounter when implementing the EHR. Other factors that can impact the EHR is interoperability, uh, the ability of different information technology and software applications that are it's challenging for these systems to communicate, to exchange data accurately, to be able to exchange data effectively and consistently, and to use the information that has been changed. So interoperability is pretty much just the systems being able to talk to one another. But then there's also a budget impact. So the initial costs associated with the EHR implementation can be immense. Project team collaboration and commitment is another one. Completing the implementation timeline according to schedule. Vendor support. When we talk about vendor support, a vendor provides the product and services required by the organization, and knowing the ins and outs to the EHR vendor selection to implement and maintain an EHR are very important. There also could be a lack of healthcare consumer awareness with social media. Healthcare organization can take consumers informed and engaged on the necessary components of the system, as well as the system project, and specifically to those that were that's impacted by the patient care. So it's so important that when we look at a lack of consumer awareness, we need to make sure that our consumer are aware. However, we tend to put that into the project plan. We need to put it in the project plan of how will we help our consumers to be aware. And then there's cybersecurity, right? The potential for cybersecurity attacks is a major barrier to implementing the EHR, because the healthcare industry method for dealing with cybersecurity attack it tends sometimes to be outdated. And so healthcare organization is working harder and working more efficiently to better this process. And so now we just want to talk about the various components of an EHR. So there's a certified electronic health record technology. CMS and ONC standards and objectives are listed here to protect patients' health information. There's a component for clinical decision support. Computerized physician order entry is another component. Electronic prescribing, as well as health information exchange. Some additional components is patient-specific education, medication reconciliation, patient electronic access, and public health reporting. And there's also the electronic document and content management. So let's talk more about some of these items. So we'll start out by talking about the electronic document content management. So one additional component, which this one is not identified, is the electronic document content management system. Let's talk about that. So a EDCM system is an electronic system that manages an organization analog and digital document and content. The EDC consists of the following components. So it consists of the document imaging technology, the document management technology, electronic records management technology, workflow and business process management technology, enterprise report management technology, automated forms processing technology, digital signature management technology, as well as the diagnostic imaging technologies. So now this brings us to the specialty-based EHRs. So EHRs designed by specialty are available for physician practices specializing in allergy and immunology, cardiology, chiropractic, dermatology, primary care, general practice, mental health, and many more. Specialty-based EHRs can be found in group practice, multi-specialty clinics, specialty centers, and individual physician office. These EHRs are developed using pre-designed and custom templates designed to meet the needs of the practice or clinic. EHR implementation becomes a matter of priority for a healthcare organization as federal regulations are enacted and initiated a change in the way information is protected and secured. So the National Committee of Vital Health Statistics gives counsels and help on key health data issues, information identified with groups and populace well-being, benchmarks, privacy and confidentiality, quality, accessibility of information. It reports frequently to the Congress on HIPAA usage and serves as a gathering of corporations among HHS and intrigue private division bunches. Now, the Office of the National Coordinator was developed to oversee the development of the National Health Information Infrastructure, which was an initiative presented to standardize the interoperable health information technology system. The NHII progressed to become the nationwide health information network. The American Recovery and Reinvestment Act became law in 2009. Now, it was developed in reaction to the recession that began in 2007. So the goal of the ARRA was to provide some relief to those greatly impacted by the recession and to invest in various organizations such as healthcare. Now, incentives were offered through the component of ARRA called HITECH. Federal policies driving the EHR was meaningful use. Now, meaningful use is a regulation that was issued by CMS in July 28, 2010, and it was outlining an incentive program for professionals, what they call EPs, eligible professionals, and eligible hospitals, and CAHs, right, participating in Medicare and Medicaid program that adopted and successfully demonstrated the use of a certified electronic health record technology. National infrastructure for the EHR, nationwide interoperability roadmap. So the Office of National Coordinator for Health Information Technology share their plans for a nationwide interoperability roadmap. Now, this roadmap introduced the following standards suggested to it to attain interoperability, and that's vocabulary and technology standards, content and format standards, transport standards, security standards, and technology groundwork standards. So this ends this part of our discussion and session.